Hi guys, it's Aaron C. Wayuntulan and I am here for Online Review Alternative. Online Review Alternative is a best source of reviews here in the Philippines and abroad for nurses, midwives, doctors, radtechs, medtechs, physical therapists, dietitians, nutritionists, EMT, pharmacists, psychometricians, and other healthcare related courses. We provide reviews for the local board examination, uh, foreign examinations such as US examination, Gulf examination such as HAAD, DHA, MOH, Prometrics, Saudi Council examination, European examinations, and we also provide Asian examinations review such as the Singapore board examination. So this is a free video for you guys, and this is part 1 of a 6-part mini series. But the thing about it is the part 1 is the only free video. In order for you to view the other 5 series, you need to enroll in any of our courses. Don't worry guys, our courses are very reasonably priced and they are easy to get into. You can view it in your laptop, in your desktop, in your smartphones or your tablets. So without further ado, I welcome you all for this particular video. Our topic for today is how to pass any healthcare examination. So all healthcare examinations share the same principle, and that is what we'll be talking about this particular day. So in order for you to pass any healthcare examination, I'll teach you the basic of test taking strategies. So if you don't know me, I am a lecturer and an author for nurses, midwives, radtechs, medtechs, doctors, and other healthcare related concepts. I am a lecturer here in the Philippines and also in Abu Dhabi, Dubai, India, and the US of A. Test taking strategies has been one of my fortes in my lecture ever since 2002 up to the present. Although I have been lecturing in different subjects, test taking strategies is one of the things that I usually teach my students in order for them to get a good chance of passing any type of examinations. Test taking strategies could be used if you're a nurse, you're a doctor, even if you're a teacher, a criminologist, or any other profession. Don't get me wrong, I'm not saying that you don't need knowledge. Knowledge is very, very important. But all the while, all the same, test taking strategies could be used even if your knowledge is not that big or even if your concepts are not that strong. So, without further ado, we'll be starting our test taking strategies. The first thing that we will be talking about for this particular video is the anatomy of the multiple choice examination question. Multiple choice examination question is the usual method of asking in the board examinations here in the Philippines or in the foreign examinations abroad. Even if you're a doctor, an EMT, a psychometrician, a medtech, a radtech, a nurse, more or less your examination is a multiple choice examination question. So, a multiple choice examination question are commonly long. As a result, it's easy to become overloaded with information. So, you need to know how you can focus on the question and not to be overwhelmed with information. You can apply my test taking strategies, and for today, we will be talking about the Fivefinger modification. The Fivefinger modification is an original concept I developed while I am teaching here in the Philippines and while I am doing my lectures. So, without further ado, let's talk about the anatomy of the multiple choice examination question. This is an example of a board examination question or a multiple choice examination question. So, if you read this, the doctor reads guaifenesin 250 mg PO Q8 hours for 3 days. The bottle is labeled 100 mg per 5 ml. How many ml should be given per dose? We have letter A, 12 ml. We have letter B, 13 ml. We have letter C, 13.5 ml. And we have letter D, 12.5 ml. So this is a general type of examination question. This could be found even if you're a doctor, an intern, an EMT, or even if you're a nurse. So this type of question could be found in any type of board examination that we could see here in the Philippines or even abroad. So let's dissect this particular question. So I will give you the three parts of a multiple choice question. So a multiple choice question has three parts. First part, from here to here. As you can see, this particular part of this question is not yet asking anything, but rather it's telling you a story. This part is known as the situation. So the situation is not asking you anything, but rather it's telling you a concept. This is a very important part of the multiple choice examination question, and that is known as the situation. Next part, the one that comes after the number and the one that is already asking you the question. This is known as the stem. Can you say that? Stem. Just like in a plant, stem. Remember, the part that is not asking anything but rather telling you a story, that is known as the situation. The one that is already asking the question, that is known as the stem. And then comes this part. This is the part where we choose from. These are known as the choices. Now it depends upon your examination. Sometimes we have 4 choices. Sometimes we have 5 choices. If your examination has only 3 choices, then good for you. Why? You will learn later. So again, let's review. What do you call the part that tells a story? Very good. Situation. What do you call the part that asks the question? Very good. Stem. And what do you call the part where you choose from? Very good, guys. Those are the choices. Now, the choices are still subdivided into 2 parts. There is a particular choice that answers the stem. In this particular question, letter D answers the stem. That is known as the correct answer. What do you call the choice that answers the stem? Correct answer. And then we have all the other choices that is not the correct answer. They are known as distractors. Again, distractors. Why are they known as distractors? Because they have one purpose in life, and that is to take away your attention away from the correct answer. So again, let's review. What do you call the part that tells a story? Situation. What do you call the part that asks the question? Stem. What do you call the part where you choose from? Choices. What do you call the choice that answers the stem? Correct answer. And what do you call all the other choices that is not the correct answer? Very good. Distractors. These things look simple right now, but as we go on to our test taking strategies, these things would play a big part. So you should know the different parts of your examination question. Okay, now if I will ask you, how many choices do we have in this particular question? We have 4 choices. How many correct answer? We have 1 correct answer. And how many distractors? We have 3 distractors. If I will make a fraction out of this particular knowledge, what do you think is my fraction? My fraction is 1 over 4. Why 1 over 4, guys? Because we have only 1 correct answer for every 4 choices. Now, if I will convert this fraction to percentage, how many percent do we have in getting the correct answer? All of you have 25% in getting the correct answer. If you think you're smart, you only have 25%. If you think you're not that smart, you still have 25%. Is it big or is it small? Very good. It's quite small. What if I could increase your chance of getting the correct answer. Wouldn't that be good? And that is the concept of test taking, increasing the chances of getting the correct answer. For example, this is the question that I am encountering in the board examination or in any type of examination. This could be HAAD, this could be US examination, this could be my Singaporean board. But the problem is, I don't know which one is the correct answer. Do I know what's the correct answer? No, I don't. But I know one thing, and what is that? It's not letter A. Therefore, if it's not letter A is a what? A distractor. Therefore, what could I do? I could take it away. Taking away a distractor is known as the process of elimination. And that is the foundation of all test-taking strategies. It's always eliminate, eliminate, eliminate. If you see in my book, I call it burning. It's always burn, burn, burn. Okay. To other students or to other who are taking the examination, they say, I have just taken away a wrong answer. I still don't know what is the correct answer. Well, actually, you did more than that. Why? Because the fact that you have already taken away a wrong answer changes the fraction. From 1 over 4, you are now up to 1 over 3. The percentage of getting the correct answer has already increased from 25% to 33.33%. By just taking away a wrong answer or by just taking away a distractor, you have done already those particular things. So, is elimination good? Yes. Again, let's go back to this particular question. I still don't know what is the correct answer. I have already eliminated letter A. But this time, I know another thing. It's not letter C. Therefore, what is letter C? Another distractor. Therefore, what could I do? Eliminate it. From 33.33%, okay, from 1 over 3, what happened now? From 1 over 3, my fraction has already changed to 1 over 2. From 33.33%, now the percentage of getting the correct answer has dramatically increased to 50%. And this is as good as it gets because this time only one is correct, only one is wrong. This is not multiple choice anymore. This is now true or false. And that is how you use the concept of elimination. Take away the wrong answers. Sometimes you can answer a multiple choice question by looking at it and choosing the correct answer. What if you don't know what is being asked? What if you don't know the correct answer? It's time to eliminate distractors. Let's have a review. What do you call the part that tells a story? Situation. What do you call the part that asks the question? Stem. What do you call the part where you choose from? Choices. What do you call the choice that answers the stem? Correct answer. And all the other choices, aside from the correct answer? Distractors. How do you answer if you don't know what's the correct answer? By the process of eliminating distractors or elimination. Okay guys, so we have already talked about the different parts of a multiple choice examination question. Now, I will teach you the five-finger modification. I call this five fingers modification because you need to use 5 fingers. Now, can you raise your non-dominant hand? Do you know which one is your non-dominant hand? I want you to close it. And then I want you to count with me. Are you ready? 1. Not like this, like so. 1. 2. Not like so, like this. 2. 3. 4. 5. Close it. Let's count together. 1, 2, 3, 4, 5. You think you can do this on your own? Can you show me? Close it. Count. Very good. You're already halfway there. Each of the finger is a representation of a tool which you can use to answer questions. So each of the finger is a representation of a tool which you can use to answer the question. Okay, first finger. What does this finger remind you of? Pinky promise? Is this the one that you use? Okay, remember way back in high school when you're learning the sign language thing? This represents a letter. What letter does this represent? Very good. It's not J, because if it's J, you have to do it like this. So it's just the letter I. So I, remember, the first finger represents letter I. Why I? Because the first tool that you could use to modify the question is what we call the issue. What is an issue? An issue is the problem that the question is asking about. It may be one of the following. It could be a drug, for example, digoxin, Lasix. It could be a healthcare problem, for example, difficulty in breathing, pain. It could be a behavior, a disorder, a procedure in the Philippines, a DOH program, or even a vaccine. Okay, can you raise your issues and repeat after me? Whatever is the issue, that's the only possible answer. Again, whatever is the issue, that's the only possible answer. What you have said is the rule of the issue. Whatever is the issue, that's the only possible answer. Let me give you an example of a stem. Look at this particular stem. Among the following vaccines, which is best for our patient? Can you tell me which one is the issue? Very good. Vaccines. Whenever I see an issue, I usually underline it, like so. Now, once I know which one is the issue, I can now perform a procedure known as check, check, check. What is check, check, check? Check, check, check is basically checking are all the choices coincides with the rule of the issue. Remember, whatever is the issue, that's the only possible answer. Is this a possible answer? BCG is a vaccine, therefore, check. Is this a possible answer? Paracetamol is not a vaccine, therefore, X. Is this an issue? Pentahib is a vaccine, therefore, check. Is this an issue? Anti-measles vaccine is a vaccine, therefore, check. Did you see it? One of them doesn't coincide with the rule of the issue. Remember, what is the rule of the issue? Whatever is the issue, that's the only possible answer. Therefore, is this a possible answer? No, this is a distractor. Therefore, what could I do? I could take it away. I could eliminate it. So what happened now? From 1 over 4, my fraction is now 1 over 3. From 25% of getting the correct answer, I am now up to 33.33%. And that is by knowing the simple and the humble issue. Did you get that? First finger, issue. What's the rule of the issue? Whatever is the issue, that's the only possible answer. Second finger. Now, what does this finger remind you of? The wedding ring. For a married individual, we place here our wedding rings. And the wedding ring reminds you of the most important person in your life. Now, if you are a health worker, who is the most important person in your life? More or less, it's you're saying patient. But always remember, patient is a term that could be used for the sick. I need a term that could be used for the sick at the same time the well. What does this remind you of? The most important person in our life as a health worker. And that is none other than our clients. So the second tool is identify the client in the question. The client in the question is usually the person with the health problem. It may be one of the following. Now, 75% of all the questions that you will encounter, the client is none other than the patient. On the other 25%, it could be a relative or significant other. It could be another member of the healthcare team. It could be a student, the community, or even a lay person. Issue has a rule. Same as with the client. What's the rule of the client? The only possible answer is a client-centered answer. What does client-centered answer means? Always prioritize your client. Can you say that? The only possible answer is a client-centered answer. Are we clear? Who comes first, the records or the client? The client. Who comes first, the doctor or the client? The client. Who comes first, yourself or the client? Not yourself, still the client. Let me give you a concrete example. Do you know if there's a fire in your healthcare facility, what is that acronym that we follow? The acronym is RACE. And what is RACE? It's not run. It's not evacuate. The evacuate in RACE is the letter E. The first thing that you should do is R. And what is R? R is try to remove or rescue your clients. So you see, in any concept of being a healthcare professional, we have to prioritize our client. So that is why the rule of the client is the only possible answer is a client-centered answer. Are we clear with that? Let me give you another example of a STEM. What intervention would best benefit the patient? First things first, I want you to get the issue. Where's the issue? The issue here is none other than intervention. So whenever I see an issue, I usually underline it like this. Now, I can now perform the first level of check. Is this an intervention? Yes. 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 Oh no. Every one of them is an intervention. So, we will use the second tool. And what is that? Identify the client. Where's the client in this particular STEM? Yes, very good. It's none other than the patient. Whenever I see a client, I usually encircle it like so. Okay? Now, second wave of check. Is this client-centered? Yes. Is this client-centered? Yes. Is this client-centered? Yes. Is this client-centered? No. Monitor for complications, that is still client-centered. Notify the physician. That makes it non-client-centered. Therefore, what are we looking at? It's a distractor. Therefore, what could we do? Eliminate. Take it away. From 25%, we are now up to 33.33%. Imagine, guys, if you can take away one of the distractors with the issue and you can take away one with the client, you now have 50%. But take into consideration that you cannot win them all. If you can eliminate one, that is already an advantage in any type of examination. Again, what is this? Issue. What's the rule of the issue? Whatever is the issue, that's the only possible answer. What is this? Client. What's the rule of the client? The only possible answer is a client-centered answer. Okay? Now, what did I put in my most favorite finger? A lot of people are asking me why I have a lot of pictures in the internet with this particular finger on. They saying, oh, he's raising his bad finger. No, I am emphasizing one of the most important things in the concept of the five-finger modification. And that is this one. This represents the most important finger. And that is the keyword. What is keyword? Keywords focuses your attention on what is important. Sometimes they do appear in different sizes or font, but most of the times they don't. What are examples of keywords? Example itself is a keyword. Priority is a keyword. Early symptoms, late symptoms, initial, vital, best, worst, and my personal favorite keyword, except. You like the word except? Chances are, if you don't like the word except, you don't know how to deal with the word except. Later in this particular video, I'll teach you how to deal with the word except. Okay? So, let's go back to those particular stems that we have encountered. And let's find the issue, the client, and the keyword. Where's the issue in this particular stem? Very good. Vaccines. Whenever I see an issue, I underline it like this. Where's the client? Very good. Patient. Whenever I see a client, I encircle it like so. And where's the keyword? Best. What will I do with the keyword? This time I would box it. Underline the issue, encircle the client, box the keyword. Underline the issue, encircle the client, and then box the keyword. Let's go to this particular question and tell me, where's the issue? Where's the issue? Is it the intervention? Very good. Where's the client? Is it the patient? What should I do now? Encircle. Where's the keyword? Very good. Best. And what should I do? Box. Do we really need to follow it? Do we really need to do that, Mr. Utalan? Well, for those who are using my modification techniques and my test-taking strategies, they usually do this. Underline the issue, encircle the client, and then box the keyword. If you don't like to do this, you can just underline everything. You can just encircle everything. You can make your own. You can heart the issue, you can star the client, and you can flower the keyword. It's really up to you. Don't waste your time in the details. What am I saying is you write at their questionnaires. Research have shown that those people who write at their questionnaires thinks more and has the higher chances of passing the examination more. So write at your questionnaires. Don't be afraid, because if you scribble in your questionnaires, it shows that you are thinking more. If you are based on a computer, you can do scribbles in a notepad. they usually give you a pad to write on. Don't get me wrong, don't write at your answer sheets, write at your questionnaires. Okay, let's have a review. What is this? Issue. What's the rule of the issue? Whatever is the issue, that's the only possible answer. What is this? Client. All possible answers are client-centered. What is this? Keywords. Why did Mr. Untalan said that the keyword is the most important? Because the last two fingers are dependent on this one. Let me tell you how to use the keyword. Okay? Keyword will tell you if you should. What do you remember if you see this particular finger? What do you remember if you see this particular finger? What number is this? It's number 1. In healthcare terms, number 1 is first. Number 1 is priority. So keyword will tell you to prioritize. Priority setting is asking yourself what comes first. What is the most important or what gets the highest priority? So keyword will tell you to prioritize. Let me give you some examples. Look at this particular stems. First stem. Where's the keyword in the first stem? If you want to go with initial, if you want to go with initial response, those are the keywords. How about this second stem? Where are the keywords here? If you want to go with immediate or immediate consideration, those are considered as keywords. How about the third stem? If you want to go with priority or highest priority, you are correct. How about the last stem? If you want to go with first or done first, you're correct. Always remember, there's no rule that there's only one word as a keyword. If you want to box half of the stem as your keyword, it's okay. Just be careful when you're boxing the keyword. Don't box the non-keyword words. Okay? So, this type of keywords are telling us to what? Prioritize. And as a health worker, we have 3 guidelines when we prioritize. And what are those guidelines? Number 1, Maslow's hierarchy. That's why physiologic will come before psychiatric problems. Because under the concept of Maslow's, physiologic problem is our priority. So whenever the keyword is asking you to prioritize, your first guideline is to use Maslow's hierarchy. Second guideline, ABC. What is ABC? Airway, breathing, and circulation. Okay, for example, you are a physician in the emergency room department and a patient comes to that particular department with 2 problems. Number 1, that patient has pain. Number 2, that patient has bleedings. So, which one of those particular problems would you prioritize? The pain or the bleeding? Do you see pain in ABC? No. But circulation, bleeding is circulation is there. So you prioritize the bleeding. I'll give you another example. Again, you are a physician in the emergency department and then a patient comes to you with 2 problems. Number 1, your client has difficulty in breathing. Number 2, your client has bleedings. So which one would you prioritize? Under the concept of ABC, you would prioritize breathing. And of course, the third guideline when we prioritize is our healthcare process. What is the healthcare process? Assess before you diagnose before you plan before you implement before you evaluate. And again, what comes after evaluation? That is a common question. Again, reassessment. So, let's review. What is this? Issue. Whatever is the issue, that's the only possible answer. What is this? Client. All possible answers are client-centered. What is this? Keyword. Keyword will tell you to prioritize. 3 guidelines in priority setting: Maslow's hierarchy, ABC, and the healthcare process. So, let's continue. Keyword will tell you to prioritize, and keyword will also tell you to... What does this remind you of? It's up or down, good or bad. Turn it into a healthcare term, and that is positive or negative. Positive statement is saying a positive thing or a basic nothing wrong sentence, while negative statement is the exact opposite of a positive response. Example: bias, judgmental, derogatory, or an offensive statement. If I tell you that you will pass your examination, is that a positive or a negative? It's a positive. Therefore, I will teach you brandings. Whenever you see a positive stem or a positive choice, you write there this: positive. When somebody tells you that you will not pass your examination, is that positive or is that negative? It's negative. Therefore, whenever you see a negative statement, a stem, or a choice, you add there negative. These are called brandings. Positive branding, negative branding. Now, how will you know if a stem is positive or negative? Who of the 5 fingers would tell you? Very good. Keywords. If your keywords are like this, therefore, your stem are positive. You can write a big positive brand over there, and then you can add positive or negative brands under your choices. How about if your keywords are like so? Therefore, what is your stem? Your stem is negative. You can write a big negative brand over there, and then you can write positive or negative brands on your choices. After branding your stem, brand your choices. Before branding your choices, brand your stem. And after branding everyone, you now apply the rule of thumb. And what's the rule of thumb? The basic rule of thumb is a positive stem is always looking for a positive answer, and a negative stem is always looking for a negative answer. Therefore, if my stem is positive, what could I do with my negative choices? I could already eliminate them. Therefore, if my stem is negative, what could I do with my positive choices? I could already eliminate them. And that is the 5-finger modification. Again, let's have a recap. What is this? Issue. Rule of the issue: whatever is the issue, that is the only possible answer. What is this? Client. All possible answers are client-centered. What is this? Keyword. Keyword will tell you to prioritize. 3 guidelines in priority setting: Maslow's hierarchy, ABC, healthcare process. Keyword will tell you to positive, negative. Rule of thumb: positive stem, always looking for a positive answer. Negative stem, always looking for a negative answer. Now, how do we use this in actual examination? Before I give you an example, we will be going into our practice slide. Any type of question could be answered using by this particular slide. Okay, so for example, this is the stem and these are your choices. First things first, identify the issue, the client, and a keyword. So go back to your old questionnaires that you have and then don't answer them. For example, you have 100 items of medical surgical, or 100 items of psychiatric, or 100 items of basic radiology. Don't answer them. Just look for the issue, client, keyword. Issue, client, keyword. Practice will be helpful whenever you are trying this particular concept. For example, my keyword is most appropriate. Now tell me, is my stem positive or negative? It's positive. Therefore, I will write a positive brand over here. And then I will use my judgment. I will read letter A. Since there is no keyword for the choices, I will use my judgment. I will ask myself, is this positive or negative? If it's positive, I will write here positive. Then, letter B. Is it positive or negative? I told myself it's biased. Based on my judgment, it's biased. Therefore, negative. Letter C. Is it positive or negative? There's nothing wrong here. Therefore, I will write there positive. Letter D. Is there anything wrong? It's judgmental. Therefore, I will write here negative. Once my stem is branded, my choices will be branded next. And what will I use? The rule of thumb. Once everyone is branded, the choices and the stem apply the rule of thumb. Positive stem, positive answer. Negative stem, negative answer. If your stem is positive, what will you do with your negatives? Eliminate them. 33.33%, 50%. Now, looking for a positive amongst negatives is easy. But now, you will be asked to go for the best among the answers. What you can do now is use these two fingers. Check, check, check for issue. Check, check, check for client. Okay? Look at your issue. Is A an issue? Check. Don't perform check, check, checks on those choices that you have already eliminated. Okay? Is letter C an issue? Check. So, issue doesn't help. But we still have one more. And that is check, check, check for client. Okay? So, is A client-centered? Yes. Is C client-centered? Healthcare worker is prioritized. And when we are prioritized before our client, is it client-centered? No. Therefore, it's X. We could eliminate this. So, look at that. The only possible answer is letter A. Did you get that, guys? Did you see how we could use this in an actual examination? I'll give you some example afterwards. What is this? Issue. What is this? Client. Keyword. Prioritize. Positive, negative. That is the Fivefinger modification. So I have chosen some examples from public health concepts. So most of the healthcare courses has public health concepts, and this could be used for any type of examinations. I just chose public health because that is also one of the things that I teach here in the Philippines. So let's use our modification technique in this particular questions, and then I'll teach you how to use it whenever you see the word except as we go on. In this particular question, where's your keyword? So the keyword here is this means. Tell me, is it positive or is it negative? Positive. Some of you didn't get that the keyword here is supposed to be this means. Well, like I've said, practice will make you better in this particular things. In our online review, we have a lot of downloadable materials where you could practice your test taking strategies. And like we've said, this is just a part 1 of a 6-part series which you could get if you will enroll in any of our online courses. So this means is positive. Look at A. Ask yourself, is there anything wrong with letter A? Changing the community is inherent. I don't think there's anything wrong in that. Therefore, I write here positive. B. After a particular period of time, the community's situation becomes predictable. Does the community situation becomes predictable? No. Therefore, negative. C. The condition the community is static. What does static means? Non-changing. Therefore, negative. D. Traditional interventions are always applicable at any given time or situation. What your grandfather does before, it's always applicable at any given time or situation. Okay, so therefore, negative. What could we do now? We could eliminate this tree. Only possible answer, letter A. Let's try a couple more. Can you find where's the keyword in this particular stem? If you see necessary to, if you chose that as a keyword, therefore, you're getting the hang of this. Now, tell me, necessary to, positive or negative? Positive. Isolate community problems from societal problems. Is that positive or is that negative? The word isolate makes it negative. B. Develop a community health plan. There's nothing wrong with that, therefore, positive. C. Identify sources of conflicts in the community. There's nothing wrong with that, therefore, positive. D. Continuously assess community situation. Again, positive. Looks like that we have a problem. One step at a time. Don't worry about the other problems yet. You have already identified that the stem is positive. You have already branded the choices. The next thing to do is to eliminate. Rule of thumb. And which one should be eliminated? Very good. It's letter A. Now, if I will raise my middle finger and then raise my index finger, what would be the answer here? Keyword is asking me to prioritize, and if I use the third guideline, which is healthcare process, this one is planning, this one is diagnosis, and this one is assessment. Which one is the answer? Very good. The answer is letter D. Do you see now how we use this particular concept in answering these particular questions, in which we don't really understand what is being asked, but we are modifying. If you learn this, guys, there's no such question that you can't answer because you can use the question against itself. Let's try one more. Public health workers recognize the roles of community leaders because, where's the keyword there? If you tell me that the keyword is because, very good. Okay? Now, tell me, is it positive or is it negative? Very good, it's positive. A, positive, negative. Negative. Let me give you a clue. The choices doesn't have keywords, but the choices has negative words. That's why they become negative. B, leadership is born out of love for the people. There's nothing wrong there, therefore positive. C, community members are dependent on their leaders. What makes this wrong, or what makes this negative? Dependent. D, community participation must be upheld at all times. Now, is there anything wrong? Therefore, positive. What should we do now? Eliminate A, eliminate C. So we are down to 50%. It's easier to answer this, but the thing about it, they are both positives. Which one is best? If I raise my client finger, what would be the answer? This one tackles leadership. This one tackles community participation. What's the best answer? The answer is letter D. Now, how do we deal with the word except? For example, we have a question with except as the keyword, like this one. So, let's go back to our practice slide. Whenever you see the word except, remember, the except is useful if you found it at the stem. Don't mind the except if you find it on the choice. So don't mind it here. Just always remember that the except is important whenever you see it at the stem. Whenever you see that the except is in the stem, that's already the keyword. A lot of books will tell you a lot about how to deal with the word except. Some lecturers even deal with the word except, and they tell you that whenever you see the word except, the stem is already negative. No, that's wrong. I will teach you my technique whenever I deal with the word except. What you do is whenever you see the word except, where? At the stem, what you do is you cover it. Don't eliminate it, just simply cover it. So whenever you see the word except, here, just cover it, because that's already the keyword. Just cover it and then look for another keyword, and then ask yourself, is that other keyword makes the stem positive or negative? And this is the rule that I will share to you. Whenever you see the word except, for example, the stem said that all the following interventions are appropriate for this patient except. So the keyword there is except. If I cover the word except, all the following interventions are appropriate. The next keyword is are appropriate. Therefore, I am dealing with a positive stem. Except cancels the positivity of that stem, making it negative. Again, whenever you see the word except, what should you do? Cover. The following interventions are not appropriate for this patient except. So, the except is there. If I cover the except, the next keyword would be not appropriate. Therefore, the stem is already negative. Whenever you add an except on a negative stem, the except cancels out the negativity, making it positive. Therefore, whenever you see the word except, don't immediately add positive or negative, just apply this rule. Let's have an example for us to see how is it being used. Let's go back to this one. Where's the keyword? Except. If this is not seen, what's the next keyword? This means. Except cancels out this means. This means is positive. So positive plus the word except, what happens now? It becomes negative. This one is negative. A. Community problems are often a reflection of societal problems. Positive. Culture shapes people as people shape culture. Positive. Community can become self-reliant while an adjacent one is not. What makes this wrong? This one is not. That's the negative word. Societal factors may have different effects on community situation. Positive. Eliminate everything. Only possible answer is letter C. So thank you guys for watching this particular video. This is the free part of the 6-part mini-series. The other parts would talk about the Itsumo test. It's the test that I have created for health workers, and it could teach you how to answer even if you don't know what is being asked. So I hope that you enroll in our online review alternative. And all the links and telephone numbers will be given in this particular video. God bless you all, guys. I hope to see you in our online review alternative.